Welcome to Outdrive, folks. I'm your host, Cliff Callis, and each week I'm bringing you actionable marketing insights you can apply to reach, connect with, and convert rural American consumers. Outdrive is powered by Callis, a full-service advertising agency with a focus on marketing rural America. Callis offers a wide range of integrated marketing services, including website development, search engine marketing, social media, video, and digital. We develop strategic and creative campaigns to build your brand and your business, and you can learn more about us at ecallis.com. Now join me in the front seat as we head out on the road to success. Let's go. Hey folks, welcome to Outdrive. We've got another great story to share with you today about life and work in rural America, a place where it's getting more challenging than ever for hospitals to attract and retain good physicians and to operate profitably while also providing quality health care. One way that hospitals are attracting new physicians to rural parts of the country is through the innovative Bothwell University of Missouri Rural Family Residency Program. And we're fortunate to have the director of that program on our podcast today. Dr. Misty Todd is a practicing family physician with Bothwell Cole Camp Clinic, where she provides primary and obstetrics care to folks in this small and quaint little community in central Missouri. Dr. Todd grew up on a farm, studied medicine at the university, then moved back to the country, where she now lives on a farm with her husband and fellow family physician. We're excited to talk with Dr. Todd about this innovative residency program, why she loves practicing and living in rural America, and what a typical day looks like in balancing a career, family, and life on the farm. Welcome to Outdrive, Dr. Todd.
Thank you. Thanks for having me.
Well, I'm excited to have you here. I'm very interested to get your perspective on a young physician living in rural America. You know, that's really the focus of our program, is helping people understand the life and the work and the recreational side of what we do. And also want to hear about the innovative rural family medicine residency, which we're doing here in our community. And then, you know, I know you're not from Sedalia, so I want to hear how you ended up here and ended up at Bothwell. But before we go down any of those roads, let's just start by having you tell us a little bit about yourself.
Yeah, so you're right. You kind of got some of my big things. I'm not from Sedalia, but I grew up in Northeast Missouri in a town called LaGrange. I am a farm child of the best parents in the world, and I will, argue for that title for them, no matter who's around. I always knew I was going to be living in small town America, but I did always think it was going to be in my hometown. And so, there's part of me that still misses that. But I grew up on a Angus and row crop farm. My dad was a manager of a farmer's co-op and sold equipment. And my mom was the cook at the local nursing home. And, I grew up like many of my patients, and that's what I think kind of drove me to do what I do is, I currently still live on a farm. I love hunting and fishing. I love to go boating on the lake. I understand why rain is so essential, not just for your flower gardens, but for your income. And so, I truly am and breathe the Midwestern lifestyle.
Which is really pretty nice, isn't it?
Yeah, it is great. Actually, before I hopped onto this, we're putting in some horse stalls in a barn. So I was out there playing with playing with guys and spray paint on where I wanted the rock and where I wanted them to put topsoil. So
And that's probably pretty fun. I mean, fairly recreational, right?
it is, and kind of just tying it in. That's one of the beauties of my job is even though I'm not from here, one of the men working on our project, his wife is one of the nurses at the hospital, and his daughter is also one of our nurses at the hospital. And so I actually didn't know his name. I was just like, well, Maddie's dad, I'm so glad to see you today. And so, that's just that different perspective, because I'm sure his colleagues have never heard him called that.
Well, it is a small world when you start talking to people. So growing up on a farm, fairly idyllic way to be raised. When did you realize that you thought you might want to be a doctor?
People ask me this all the time. I think I was like 11. I was working cattle with my dad. So I was the only child. And so I was working cattle with my dad and his friends. And I had an idea of how we should fill the syringes and how we should run the cattle through. And they wouldn't listen to me. And that's when I realized, like, I'm never going to get rural American men to listen to me about my ideas. So before that, I thought I was going to be a veterinarian. And I was like, no, there's no way I can ever convince them to do something differently than how they've done it their whole life. So maybe if I learn something more about medicine, they'll listen to me with that, because I always knew I wanted to help people. And I did a lot of shadowing through high school. I grew up in a rural area. The closest hospital was about 45 minutes away. So my junior year of high school, I drove 45 minutes in my, 1996 Chevy Corsica to go and volunteer at the closest hospital to see what it was like. And after that, I was hooked. And so from then, there was really no looking back. I learned that, medicine is about being a scientist. It truly is. At the end of what I do, I still think I'm a scientist, I'm a teacher, but it's really about people and relationships. And, that's what I saw growing up in taking care of cattle and taking care of farms. It was really a community effort. And what I've tried to create in my career is translating, a community effort to take care of people.
I think it's neat how all those threads come together to make you and what you do. So how'd you end up at Bothwell?
Oh, I fell in love with a man and I moved.
Funny
No,
how that happens.
it is, but I married one of the best men on the earth, so I lucked out. My husband and I met at Westminster College in Fulton, and we were in the same class there, and we went to different med schools. We went to the same residency program. And then as we were looking for jobs, we both luckily wanted a very similar vision. We knew that we were going to live in the country. We knew we were going to have kind of a farm on the side. We knew that we wanted the outdoor lifestyle. We knew that we didn't want to be, one of 80 doctors in a multidisciplinary clinic. We wanted to be, community minded and part of a tight-knit community. But I really wanted to go home. I'm a home girl. My mom's one of 13. And so I am one of about 37 cousins that doesn't live within, the 45-minute driving area of home. So I am, homesick for that. But Dr. Fredrickson, who is one of the kind of pillars of family medicine of the community, had reached out to me because he is a great idealist and had secured some grant funding from HRSA, which is the Health Resource Services organization for the United States. And they had grant applications for a rural residency. And at the time, he knew that Matt, my husband, is from Sedalia and would be interested in coming back and would be family medicine. But at the time, I was serving as chief resident at the University of Missouri. And so I was in a leadership role and I did a lot of things. And so part of what I wanted to do, no matter where I go, is to continue to take care of pregnant patients and provide OB care. And so he approached me about helping him run this residency and eventually taking it over. And I said, I'm so sorry, Dr. Fredrickson. Like, I am meant to go home and serve my community. And he said, oh no, come, like, it's great. We've got a good med staff. This has great opportunity. You should come see it. We really could use your energy and your drive and your vision, and you're well connected. Like, this is perfect. You should do it. And so after about a year of advocating and touring, I realized that this is actually the place that I was meant to be, and I didn't know it. I just had to be open to the idea. And so it's crazy to say that, 4 years later, here I still am and very happy.
So I think it's really cool that you and your husband knew what you wanted, and equally cool that you found it here. And so we're so glad that you're here. If I understand it right, there are not a lot of family physicians who still like to treat pregnant women and deliver babies. Why is that important to you?
I'm gonna reframe that question. So I'd say that a majority of family physicians actually do enjoy delivering babies still. But my husband is someone who is trained in it and still doesn't do it. He says he likes to sleep at night. And so it's really a lifestyle balance. It's also kind of how you are trained. OB is very scary. So our OB-GYN colleagues, they do an extra year of training. They do a lot more surgical training. And OB care is great and seems lovely, and most deliveries are fantastic and everyone's happy until they're not. Patients get really sick really fast, and then you have two patients instead of one. You have a mom and a baby. So a lot of that has to do with their training. I was really fortunate to be trained and mentored by Dr. Laura Morris at the university, and she actually worked in Fulton, and I shadowed her when I was a undergrad. And so I saw the relationship she had with her patients, and I saw when she had, 10-year-old kids in her clinic that she had delivered and, was working on delivering grandbabies of patients that she had taken care of for, years and years, and really that multi-generational care and being the face of relief that shows up for patients in a moment that's really scary for them. And so that is really what keeps me going.
So talk a little bit more about the Rural Family Medicine Residency Program. For those people who have never heard about it, what is it? How long has it been underway? Where do you see it going?
Yeah, so I always start when people ask me this question, just talking about residency training and what that really is. So being a physician is quite a long, arduous process, and it's confusing to people from the outside. So to be a physician, you have to have an undergraduate degree. So 4-year college degree, you do 4 years in medical school. And then depending on what specialty you want to be in, you do what we call a residency, which is you are a licensed practicing physician, but you have a training license where other physicians train you. And so our training program is for 3 years because we're family medicine, which is a specialty. So general medicine, we're thinking, 1950s residencies didn't exist. And so family medicine is actually a specialty. So when people ask what I do and they say general medicine, I try and educate them because it's actually a specialty. We take boards, we're certified in lots of different areas, but yes, knowing our limits and when to pass off to consultants is essential. So our program is 3 years. We are very unique. We're the first rural training track for family medicine in the state of Missouri. There are others across the country, but what we have created here is kind of the best of both worlds. And it's a collaboration with the University of Missouri Family Medicine Residency at MU Healthcare. And at Bothwell, we are a wonderful small community hospital, but there are some things that we can't treat here. And we don't treat here, and we stabilize and ship those patients, or we try and get them to higher levels of care before they come to our door. And so there are things that I need residents to see to train them in that I can't provide here. And so by making a partnership with the university, they can see some of those patients. They can see patients after heart valve transplants, or they can see patients after liver transplants, or they can, work and train and provide care for very premature babies, 25, 26 weekers, which far exceed our capabilities here in our NICU in Bothwell. And so that collaboration allows them to see kind of the large academic institution work with multiple specialties, multiple fellowships, anyone that you want is at your elbow. And at the same time, they start their continuity clinic in Sedalia that same year. So they're in Columbia about 5 or 6 days a week, and they're with us 1 day a week in Sedalia because we really want them to start their patient panel, to get involved in the community, to understand that longitudinal relationships equal better care, and to increase access to patient care in Sedalia because we are in a very large doctor shortage area. And so after they complete their first year, they have completed, we call their first year their intern year. And then their second and third years, they're considered senior residents. And that is when they do all of their rotations at Bothwell. So they are rotating with the family medicine doctors on inpatient. They're rotating with our general surgeons doing surgery and working in their clinic and doing colonoscopies and EGDs. They're working with our pediatricians in their clinic and doing newborn rounds with both family medicine and pediatrics. They're doing gynecologic surgeries with our obstetrics and gynecologists. They are working with our orthopedic doctors, setting shoulders, doing injections. And so, they're really integrated across all disciplines in our hospital to understand how rural medicine works and, learning from all of them, but really learning what rural medicine in Sedalia is like, all while we're still teaching them and grading them. And there's didactics and there's in-training exams, and it's still very much a formal education, but those things are done here.
So essentially, Bothwell is functioning as a teaching hospital.
It is a teaching hospital. So our residency we got initial funding in 2019, initial accreditation in 2021. So for the last 3 years, we have been considered a teaching institution.
So I'm assuming that after a resident goes through this program, the hope is they're going to stay here, right?
Yes. So I wish, in my idyllic world, when I have a magic wand and can do all the things I want, we would keep them all here. But the reality is that we're not. And honestly, not every physician is going to do great in this setting, even if they think they're going to. So, what we want to do is create an environment that supports them to reach their goals. And yes, have all those community ties built in and hope that they feel nurtured and supported and do want to stay here. But in reality, if we could even keep one every 2 years, that would continue to grow our medical staff population, which is very much depleted.
So as a community member, is there anything that we can do to help that cause, or it just needs to be a good fit for both the physician and the situation?
So I think it's a bit of both. So no one wants to stay in practice in a place where patients don't come to see them. And that was one of our biggest concerns. Dr. Fredrickson, Dr. Sharp, Dr. Cahill, they've worked here for decades. They have a large patient following. And we were very apprehensive about introducing new young doctors in the same clinic. And what does that take? And honestly, our patients have, taken to it so well. They know that, their family physicians are still treating them and they're getting good training and they're easier to get into. And sometimes they explain things better than us. Everyone kind of says, oh, I don't want a young doctor. I know what they're doing. But they're closer to the evidence and their brains are ticking so fast. And sometimes we get in our patterns of saying things the same way and not explaining things well. And so there is a real benefit to having it seen through another lens and seeing another doctor sometimes. That being said, the community supporting them, come to see them, has been great. Their panels are very full and they are very popular. And then there actually is a patient advisory committee that John Meehan is steering with me because we know that we can't just say, hey, come to Sedalia and be part of the community. So we have ways to kind of introduce them. And so that committee has done a couple things through a match party with them, which is the day that we find out who our next residents are going to be and we celebrate them. They took them to the Knights of Columbus Fish Fry. We have a golf outing at the golf course. We've got them involved with the chamber. We've tried to provide them with Heckart passes so they can, enjoy some of the local things. And so really trying to get them in with people. I think it's really difficult I'm the director, but their schedules are really busy. They have a lot to learn in a short amount of time. And so, let's take them out for an afternoon coffee isn't really conducive to their schedule. So we do a lot of early morning meetings and a lot of evening activities with them.
Well, that's a great program. And it's great to hear that they're busy with patients. And I know that, that makes them feel productive and purposeful. And I've noticed that there are several young physicians in our community today. And I don't think they're all residents, right? There are some that have settled here and are practicing here. Why do you think that is?
Oh, I feel like this was a setup. So the community is very lucky that they have physicians that have been here for decades and made their lives here. I think two of those kind of unsung heroes are Dr. Bill Woolery and Dr. David Roars, so pulmonology, critical care, and radiology. And they raised some great children. Medicine is a small world. So Dan and Matt and I trained at the university together. And when we agreed to come here, I went to Dan and I said, hey, we're going to try and start this residency. I know that you were the internal medicine chief. I'm going to need some help. We need to, kind of beef up our recruiting efforts. And so in doing that, we were able to recruit a lot of around my residency class. And so Dr. Wadowski and I trained together in the same class. Dr. Emery and Dr. Roars were in the same class, and we were all very close friends. We were fortunate that Dr. Norfleet, she's local from up at Hughesville. She was a year behind me in medical school and we still had touched base. And, she trained in Texas. Her residency was in Texas. And we're so glad to have that outside perspective and very fortunate, just some others that joined our group. Dr. Gabe Anders works with Dr. Woolery, and he's also a young pulmonary critical care doctor who's multi-specialty boarded in pulmonary critical care, sleep medicine, and internal medicine. And so for people who think that they're not getting good care in small communities, we have some of the smartest and brightest young physicians here in our community, and we're very fortunate.
We are lucky. How do we change that perception? How do we help people understand that the care can be just as good here as it is in a bigger city?
I think they have to experience it. I've had a lot of aha moments. I did my residency training in Columbia. I went to med school in Columbia at the University of Missouri. I was a chief there. I stayed there on faculty the first year that I worked in Bothwell trying to set up this residency. So I was in both places. And just kind of the light on people's face when they would come to my clinic, or I'd deliver their baby, or they'd be seen at the university, and I'd say, oh yeah, I run a clinic in Cole Camp and I have some partners in Sedalia if you want to stay there. And their face would just be like, you're in both places. Or, they'd be admitted to the hospital at the university for something we can't provide here. So they had a stent placed in their heart. And when the doctor says, well, we need you to follow up with your PCP. And I say, well, we don't have one. And they say, well, I trained Dr. Todd, or I trained Dr. Roars, or I trained Dr. Emery, or I trained Dr. Wadowski. Go see them. They're in your hometown. Their face kind of lights up. And, really word of mouth has spread quite a bit, knowing that, we are the people that they used to drive to see in the city, and we're here.
Well, we're glad you're here. Let me just say that right now. We appreciate everything that you're doing for our community and for the region, really. As I think about your background, and I think about you staying in state and going to school, and then as I think about you locating here, it seems like it's all just kind of come together nicely, and you're so well prepared to lead this program. Do you think that having that leadership opportunity at the university helped that?
It for sure did. The residency that we have would not be this successful if we did not have the collaboration with the university. That being said, there was a lot to learn, and I think, I appreciate the accolades, but there was a while there where I was the youngest program director in the country because it was a lot of work, and I actually had to get an exemption and do a fellowship in academic leadership to be able to stay on this position. And so, not to belittle anyone who does this position without having to do that, but that was a lot on my plate in the beginning and a lot to take on during a pandemic when this was getting up and running. And so I feel like I have learned a lot along the way, but having that safety net of mentors at the university on how to run a residency was grateful. But truly, the medical staff here, my co-family physicians and surgeons and our home crit care docs, they are the ones that held me up. I would literally go in and say, hey, we need to come up with this rotation. Can you do this? Are you willing to do this? And everyone said yes. And now that the residents are here, they have been able to see and kind of reap the benefits of knowing they're here. I think one thing I want to touch on is, there's this perception that by teaching somehow doctors have to do less work or make more money. It's actually more work to teach because it slows us down to teach well and to give constructive feedback. And no one that teaches our residents gets any pay different except for me because I have to do a bunch of administrative tasks. But when when they're working with our surgeons, when we're working with our pediatricians or orthopedic surgeons or OB-GYNs, they're not getting paid extra to do this. They're doing this out of the goodness of their heart. And enough cannot be said about a small community hospital who already, has financial strains from COVID and staffing issues because there is a national shortage of doctors and nurses, being willing to say, you know what, we're going to make this a priority and we're going to continue to train doctors here because we think that's what we should do and it's the right thing to do.
I agree with that. Well, I know you have to have a lot on your plate. I think people would be interested to know what an average day looks like for you.
Oh,
is there an average day?
Every day is different. I can run through yesterday. That was I can run through yesterday. So yesterday I was on call for newborn care. So I was covering for the pediatrician. So I went in the hospital at 7 a.m. There was a C-section planned. I wasn't doing it, but I was there to resuscitate the baby. So I stayed and did that. I had 6 other patients in the hospital to round on. So different infections or pneumonia or heart attack patients that I was seeing. I hopped on 2 Zoom meetings because no one in administration can ever do anything without Zoom meetings. We all have Zoom meetings now, which I'm grateful for. I took 2 admissions from the ER. I had a laboring patient all day. We had a couple of triage patients come in, played a lot of phone tag with my husband because he is also working. And I had mentioned earlier, we're trying to put in some horse stalls. And there's not really, when we're at the hospital, it's kind of do everything as you want because we're on call for 24 hours at a time. And I've been on a little marathon. So it was like, hey, did you talk to the guy bringing the rock today? Doing a little bit of life in there. I met with one of my residents, Dr. Pendergraft, who had done the C-section. We debriefed. We went over how it went. She did great. Talked with some colleagues about patient care, and then all of a sudden had a bunch of admissions from the ER. My laboring patient ended up needing an emergency section, so we did that. And then I finally got done with my charting around 10:30, made one walkthrough, was home around 11, and got a couple calls overnight, didn't have to go back into the hospital, and then was back there by 7 this morning and rounded on another 7 patients, gave some feedback, some more meetings, have called my clinic nurses about 4 times because, patients have needs, even though I'm not in clinic. I think there's this misconception that just because I'm not in Cole Camp seeing patients, I'm like out playing golf. I'm not, I don't like golf. But, I had a couple patients that needed enrolled on hospice or med refills, and so in the nursing home needs to be seen because I also see patients at the nursing home in Cole Camp. And so trying to balance all of that, I have a great team that, keeps everything in line and feeds me accurate information and makes it so I can take the best care of people I can. And then met with my residency coordinator, who is Ellie Ewer. She is the one who's in charge of our residents' licensures and their schedules and helps a lot with recruiting and retention. And, she's probably my right hand for sure. Met with her and then got on here with you. And so that's kind of my day. And so
I
this
think that
evening I'm
was like,
on call.
I think that was like about the last 36 hours, maybe.
It kind of just all goes together.
It's a pretty good day. Well, real
Yeah.
quickly, how your husband's also a family physician. How do you guys balance work life?
We are polar opposites and opposites attract. So he compartmentalizes really well and can turn work off when he's home. I don't turn work off well anytime. It's kind of just always going. And so one of the things that we have made our rule is if we are not on call, our phones go off. And so between us, we're on call usually 3 to 4 nights a week, which is a lot. Between pediatrics, OB, and family medicine. But when we're not on call, we really try and capitalize on that time. And then making boundaries is really hard. We're in a really nice community and people want to friend us. And we also want to be friends because we are friendly. But there comes a time where we're just like, no, we just need to be alone. And so that is where we do love our farm and we'll go out and, work cows. We usually work cows alone, and that's therapeutic and a test of a marriage, as everyone that's ever done that can tell you. But, go play with our dogs, garden, do those things. But when it's not time to work, we shut it off pretty hard.
That's a good approach. You grew up in rural America. You chose to live in rural America. For those people who are out there that may not have a full understanding of the lifestyle that we enjoy, tell them about it.
Oh, it is great. I think when I interview residents or applicants who want to come here and they're interviewing here because they have an aunt that lives here and they've never been to Sedalia. They're like, why do you work there? And I say, because my patients care about me as much as I care about them. And I mean that sincerely. I have had patients call me or call my clinic and say, hey, there's cows out on the highway in front of your house. Are they yours? Tell me what gate you want me to put them in and we'll get them for you. Or, hey, Dr. Todd, I think the breaker on the south side of your house is out because your Christmas lights weren't on last night. And, their tokens of appreciation are, like the cookies or the handmade quilts. We are one family and we laugh together and we get to celebrate newborn babies and we get to, cry together when it's time for someone's passing. But I could never imagine not knowing my neighbors. And I could never imagine, being able to juggle the amount of things I do between farm and work and the residency and marriage without neighbors who are family. That is truly what I think makes rural America great. We have made such good friends and neighbors here. And I am a non-believer because I was like, no place is as good as my hometown. Like, all of my friends are here. I know everyone that can fix everything here. I have everyone's cell phone number that I could ever need anything for. How am I ever going to survive in a new town? And I wish I could go back and tell myself, you'll have that figured out within 2 years. So it's all about those relationships.
Absolutely. Well, Dr. Todd, I really appreciate you being on our podcast today. I think for those people who'd like to know a little bit more about you, they can go to brhc.org, Bothwell Regional Health Center's website. As we close, what else would you like to share with our audience today that you think they might find interesting or important or maybe inspirational?
Yeah, so I always tell people, doctors are people. I grew up in a family where no one was a physician. There was one full-time physician really in my county when I was growing up. So I had no perspective of what it meant to be a physician. I just knew that I wanted to help people and I was good at science and I really liked relationships. And that's how I got here with a lot of guidance and mentorship. But really, we want to know you and we really want to help you. Doctors, and I'll speak for myself and my husband, we don't go into this to get rich. If I wanted to get rich, I probably would have done business and been a lot ahead and not worked nearly as much. But, we are people and we do want to know about your family and we do care. And I do lose sleep over patients. And so if you have questions about anything, always ask. And then I tell all my younger patients, dream big. If this is something you think you want to do, I will be the first to tell you, like, I am evidence that you can do and achieve anything you want. You just have to seek it out and find those mentors. And so I am happy to mentor or connect you with anyone if this is a career path you're interested in.
Thank you. That's a great pitch. Appreciate you being with us.
Yeah, thanks so much for having me, Cliff. I appreciate it.
You're welcome. Folks, thanks for listening to Outdrive. I hope you've enjoyed our visit today with Dr. Misty Todd. Come back again next week and I'll take you down the roads of rural America where it's heaven on earth.
Thanks for taking a ride with us on Outdrive. This episode is complete, so head on over to ecalis.com for more insight you can apply to help drive your business growth. And be sure to sign up for our free monthly e-letter, Outthink, for even more helpful content about marketing to rural America. Have a great day and keep on driving.